Hi everybody, this is Dr. James Reade, a chiropractic physician and certified functional medicine practitioner. Well, it's a wonderful day here in Arizona, a nice beautiful winter day as you can see. And in our new series we wanted to go ahead and start with some lower back stretches and exercise that we can use to go ahead and help alleviate back pain. With these exercises, of course, we want to improve the not only stretching and flexibility, but also the coordination of muscle movement. It's important to make sure your hips are, moving correctly, your glutes, your back muscles. So some of these exercises are going to go ahead and address some of that. More importantly too, while you're doing these exercises, if it does cause a lot of extreme pain, numbness, or tingling, you need to probably back off and have your back evaluated to see what might be some other underlying issues that are occurring. Another important thing is make sure you hydrate yourself, okay? Because when you do some of these stretches and exercises, yes, you're going to produce, some waste byproducts. There may be some, injury or slight damage or inflammation from the tissues. So I know this is kind of a lengthy introduction, but we just want to go ahead and map out some of these things ahead of time so that we can begin to go ahead and jump into those exercises. So I hope you enjoy this series. It's going to contain actually 8 basic stretches to start off with. And some of the keys here is to make sure that you do it nice and slowly and that you use a concerted effort to think about going through the movements. And breathing is also another important thing as well too, that you take some nice breaths in and out while you're doing these stretches. So with no further ado, let's go ahead and get into doing some of the exercises. So here we go. We're going to go ahead and start off, and maybe some of the things that you may want to go ahead and utilize when you're doing some of these 8 basic stretches to start off with. You may want to go ahead and get like an exercise mat just for comfort, like a small pillow to support your neck, or a rolled towel would be just perfectly fine. I know later on in some of these you may want to get like some straps or rope or a belt that you can use to actually help with you bending forward. But for now, we're going to go ahead and not use some of those and just kind of use some of the basics right here. So first off, we want to go ahead and get into the basic starting position. And so you're going to get down on one of your knees here, and put your arm out here, and you want to come down here like this on your side, and then swing yourself over and go ahead and lie down here on the mat with your knees bent, and put the pillow underneath your neck nice and comfortably. Okay, so the first thing is that you want to go ahead and get into this position, knees bent. Just go ahead and take some nice deep breaths in and out. Relax your back, let it kind of sink in to the mat here. Now, the very first exercise that we're going to go ahead and do here is that we're going to go ahead and bring the knee up towards the chest, and then go ahead and extend the leg out. Now, when you're doing these exercises, what's recommended, you probably do 8 each. 8 on the left, 8 on the right side, and do 3 sets of 8. That would be an appropriate amount to go ahead and utilize when we're doing these exercises, and that's true for all 8 of these. So let's go ahead and start. You can go ahead and take a full breath in, bring the leg up, and then stretch it out. Exhale. We'll bring it back up again just to go ahead and do another demonstration. Take a full breath in. Exhale and let it out. Remember, try to keep this other leg planted here. Now, just to kind of show you what we do on the other side, we'll go ahead, deep breath in, exhale, take a deep breath in, and exhale. And we'll bend this back up again and relax. Now, I also wanted to point out that as you go into your doing your 8 on each side, you can try to go more intensely as far as motion goes, but not to the point that it's causing a lot of discomfort or pain. Just go ahead. You may have to push yourself just a little bit, but again, don't try to like race through these exercises. Go nice and slow and be cognizant of your bringing your leg up and the muscles that you're going ahead and activating when you bring the leg up and down. So that's actually exercise number 1. So this is exercise number 2. So what we're simply going to go ahead and do here is bring the leg to the side here. Just be like a frog leg. And just hold it for about 3 seconds. Bring it back up. And again, what we're going to go ahead and do is just drop it to the side. And while you're doing this one, you may notice there's quite a bit of an imbalance between your left and right side regarding flexibility, but I wouldn't worry about it. As you're doing these, they should begin to level out and become even. And of course, that's part of the idea behind the different stretches here. So bring it back up. Let's do the other side. Drop it down. You can exhale. Bring it back up. Inhale. And again, just do it nice and slow. Hold it for about 3 seconds down on the ground. Exhale. Inhale and bring it back up again. So that would be exercise number 2. Okay, so this is exercise number 3. So what we're going to do here, start in the starting position. Bring your leg up. Inhale. Exhale as you bring it down, the frog leg, straighten it out. Inhale again. Take a deep breath. Let it come down. Straighten it out. Inhale, bring it back. And again, you want to do it nice and slow. You don't want to rush through a lot of these things. So that would be exercise number 3. Okay, well, let's go ahead and do exercise number 4. Now on this one, we're actually going to be using both legs at the same time. So we're going to basically do 8, and we'll do 3 sets of those. So let's go ahead and I'll show you number 4. So you're going to take a deep breath in, bring your legs up and out. Stretch them out a little bit and then come up. Bring your legs back down. Let's do that again. Deep breath. Legs out, exhale. Bring your legs up. And then back down again. So that would be exercise number 4. Okay, for exercise number 5, we've gone ahead and moved into a different position here. And what we're going to go ahead and do here, again, it's being done on both sides. So, go ahead and do your 8 of them and do a set of 3 for each. So basically, you're going to start off like this. You want to go ahead and bring your legs into the frog position and try to lean forward. And the key here is hold it for about 10 to 12 seconds. And you want to do some nice deep breaths in and out. Just allow the muscles to relax in the inner thigh, the glutes. The important thing is try to relax into this position. You can go ahead and lean forward a little bit as you're continuing in some of the sets. and try to go ahead and get your muscles in the back here along your legs to kind of try to pull things down and relax the inner thigh muscles. So that would be exercise number 5. So this is number 6. It's similar to what we did in number 5, except rather than doing both legs, we're just going to do a singular leg. So we can start off here, bring yourself forward, some nice breaths in and out. Hold it for 10 to 12 seconds. And again, it's try to relax into this position, try to get the leg to pull down here, be cognizant of what's going on here in your back and your pelvis. You can bring this back here, and we'll do exactly the same thing on the other side here. Okay. And again, hold it for 10 to 12 seconds. Breathe in and out, nice and slowly. If you're outside like me, enjoy the fresh air and the sunshine while you're doing these. Make your connection back and kind of relax and enjoy the moment. And again, with these, you want to go ahead and do the left and the right. You do 8 of them on each side, and then 3 reps. So that would be exercise number 6. All right, here we are again. We're going to lie on the ground, and this is number 7. So we're going to start in the start position. This is going to be like a crunch. So you're going to place one arm right over here, the other one behind your neck. The idea here is to take this elbow here that you have bent and approximate the body towards the opposite knee. So the idea is not to bring the elbow, okay, or just the knee to each other, but using your muscles in your abdomen. And then try to keep this leg straight as you're bringing it up. So you can go ahead and inhale and exhale. Inhale and exhale. And again, I wanted to point out what's important about this. In order for it to work, you want to make sure you're not trying to just bring the elbow and the knee towards each other, but you want to try to use your abdominal muscles here. So we'll just go ahead and do one on the other side here. You can inhale. So that would be a type of crunch, and that would be exercise number 7. Okay, and here we are for number 8. Find like a bench or chair where your legs are actually bent here about 90 degrees. Your feet are, flat on the ground. You want to go ahead here. This idea is to, contract some of the muscles in your back. And at the same time, you want to go ahead and take some nice deep breaths in and out. And you're going to be pulling here with your arms and trying to compress your spine against the chair here. And again, you want to contract some of these muscles in the back and maintain your breathing in and out. You're going to hold this for about 10 to 12 seconds. You're going to go ahead and do 8 of them, okay, and do 3 sets. So here we go. You can take a breath in, pull up, exhale. Deep breath. And out. Deep breath in. And out. Deep breath in. And out. Deep breath in and out. And we'll go ahead and show you the same exercise at a little bit of a different angle. Okay, so this is the same exercise number 8, just from a different angle. Just wanted to point out just a few things. Again, you want your feet flat, you want your back straight, you don't want to be leaning forward, leaning back. You want to try to keep your back straight as possible. And again, the focus is trying to go ahead and contract your muscles here while you're also applying some compression by using your hands underneath the chair and pushing down on your back. And again, the important thing is to contract these muscles and at the same time, breathe in and out. So we'll go ahead and do a little demonstration. And again, you want to hold it for about 10 to 12 seconds, this position, not your breath, but this position. Full breath in and out. 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 So those are some of your basic exercises. And I wanted to just go ahead and point out that these are some just basic ones that you can start off with. As you're going ahead and progressing with doing these, it's usually recommended you try to do these about 3 times a week. And by doing that over a period of maybe about 3 weeks, you can begin to increase the intensity of some of these particular exercises. And we'll go over some of that in some future video here to show you just a little upgraded level of some of these 8 basic exercises. But in the meantime, these are some that you can start off with, and I hope you enjoy learning about some of these basic stretches and exercises that we hopefully will seem to help with your lower back problems. And of course, some of these stretches you can use for any type of sport, just for general health. And a lot of you people that, we do treat here at the office do have, lower back problems. So these are some stretches that we suggest that you try to also help complement your care, or try to go ahead and utilize before you come in for treatment to see if it provides any kind of relief. And of course, I usually recommend more stretches and exercises after more of the acute inflammation has gone down and you begin to have a little bit more of a functional movement. Right away, if you're in severe pain, these are probably not the best things to go ahead and utilize at the moment. But trying to get the inflammation down is a key thing, especially if you've been so out of shape and your back is not really balanced correctly. So having plenty of water flushes your body out. Having a healthy diet also allows the tissues to heal correctly. You want to also make sure that you have good, strong ligaments. So there are different nutrients that help with your ligaments and discs and allow them to recover as well too. And of course, we do some of those evaluations and determination here at our office to see if you do have some issues with your ligaments and tendons and muscles, and if they would benefit from different types of nutrients or dietary changes as well. If you want more information on that, of course, just go to our website. We have a multitude of different types of videos and articles that address some of the different things that can contribute to back pain and also different types of joint problems. So I hope you enjoyed watching these different exercises that you can do for your lower back. We're going to go ahead and do some future videos on other types of exercises that you can do, for example, for golfing, for other types of lower back, and probably also for some neck issues as well. So I enjoy going ahead and doing this, being outside. Again, a beautiful sunny day here in Arizona. So I hope you enjoyed watching this, and I hope you learn from it, and I hope it can be of some help to you. And once again, this is Dr. Reade, and if you need any help, you can go ahead and contact our office at 480-732-0911. Thanks for watching, and have a wonderful day. Hey, Dr. Reade here. If you'd like to get the latest information and also some of the promotions that may be going on in our office, go ahead and subscribe to our newsletter and also our channel, our YouTube, and also Facebook as well too. So once again, we want to go ahead and just thank you for watching, and we wish you the best of health, and we'll see you soon.